Hello, this is Jason Straw. I'm going to go over the Indiana Opioid Crisis and medical cannabis as a solution. It's presented by me, and Jeff Staker's not here. Nicole Anderson edited this for me. Here's our first chart, Indiana drug use problem. So in 2016, according to the National Survey on Drug Use and Health, 391,000 Indiana residents had a substance use disorder. Of these, 361,000 did not receive treatment from a specialty substance use disorder treatment provider. Delayed treatment access can mean an instant risk of death and other harm associated with substance misuse. You can see on the right-hand side the chart, and so that means that about 30,000 people had been treated in Indiana, which is about 10% of the state being covered in that time period they're talking about. So, substance use disorder population comparison. About 63% of people who have a substance use disorder are in jail. 58% of these people are in state prisons, 45% of people in federal prisons. 5% of the population are just in the normal population. So as you can see, most people are in jail for some reason or another who have a drug addiction problem. So, history of addiction treatment providers in Indiana. As you can see, historically, since 2009 to 2019, providers have been climbing up until 2017 for outpatient clinics, and then they started to decline. Inpatient, it's been declining up until probably about 2015, and then the rate started to slowly increase. So Indiana, which has been ravaged by the opioid crisis, has seen big growth in addiction treatment. Currently, 165 providers are certified to operate outpatient addiction treatment services across the state, up 67% from 2009, according to the Division of Mental Health and Addiction, a unit of Indiana Family and Social Service Administration. Another 95 providers are currently certified to offer inpatient treatment, up 25% over the same period of time. Here are the different numbers being reported by the different agencies. So you got the Indiana State Department of Health in yellow, Medicare in orange, and then the National Institute of Drug Abuse in red. So it's Medicare reports a lot more people dying from the numbers that they're getting from Indiana than anybody else. So it's interesting that the numbers are slightly different from each agency, and that National Institute of Drug Abuse and the Indiana State Department of Health are very similar, but not quite the same. So here are the estimated totals that we got off of from a report. And then here, when you look at it, you get all the different reports that Indiana's giving out to different agencies. So the counties reporting to the state, those are total death rates. I just want to show you the difference for total death rates compared to opioids. The other ones are reporting their opioid death rates, where the county reporting to state is total. So just make sure to realize that the bright teal ones that are shooting up really high are totals, not the opioids. But the rest of them here, when you look at them, that are different, you have different ranges, those are reported all to different agencies, and they're all different numbers. And it's funny because, to me, that the state's giving different numbers to different people, and the yellow one here was the one that the state reported to the media. So it looks like there's a downward trend. And then if you look at the purple, it's the new Indiana webpage, which is similar to the ones they gave to the media, but not quite the same. And then the Indiana Department of Health they have two different numbers here that they're posting, and it doesn't even match up with the Indiana new website on the opioid crisis. And you can see one of them's about 400 and one of them's about 900, and they don't even match up, where the new website is higher than what the Indiana Department of Health is reporting. So the numbers are way off and they don't match up. So I think an investigation needs to be done. Here's Indiana total drug deaths reported by the counties. So when you look at this, there was a drop in 2016. This is what the counties was reporting. These are the big numbers in teal that you saw. So when you look at this, something happened from 2015 to 2016 that made a drop. That year in 2015, Narcan was introduced. So you can see how the effect of Narcan had. 2013, 2014, 2013 they passed a law restricting opioid overdoses for drugs. So they restrict the providers from prescribing opioid drugs. So, it didn't seem to have the effect that they wanted because it kept going up. Narcan, when Narcan came on board in 2015, it seemed to have almost an immediate effect. 2017, they're like, oh, let's restrict again, like they did in 2013, 2014. So we restricted again, and it started to climb again. So restricting opioids by medical providers doesn't seem to work. So suicide rates. Suicide rates have steadily gone up in Indiana through the years, but here's the rates. So 2013 is when they right here is when they passed a law restricting providers from giving out opioids, and then 2015 is when they did the Narcan. 2017 is when they restricted again. Look at these big jumps every time they restrict medical providers from prescribing opioids. So it doesn't seem to help our opioid overdose rates, but it does increase our suicide rates, which is a negative outcome. So the Indiana emergency rules, the Indiana emergency rules, Indiana implemented emergency December 15, 2013. This is the laws that they had put in place in 2013 that affected. So they restricted morphine, nothing greater than 15 milligrams a day, nothing over 60 milligrams of opioid-containing pills no more than 60 pills a day. This is 2013. So I wanted to let you know what was happening in 2013, because now you can see why you had the jumps in suicides in 2013. Here's the opioid overdose rates from 2009, 2016, and 2013. These are just the ED visits. So you can see 2013, 2014, limiting the amount of opioids, it really had a big jump in 2013, 2014. Look at how big that jump was. 2015, 2016, well, you know, Narcan doesn't stop people from taking opioids. It just treats the problem. So it was still elevated. The jump, you know, really didn't stop the stem. It's just a Band-Aid. And then here's what I was talking about with the numbers for Indiana that IU, the report. So I'll just let you look at these. You know, they give you a little bit of information on where we're ranking from the IU report, where they're looking, and I believe it gives you some valuable data. And right here is where they talk about only 10% of people who need treatment got it, and 4 out of 5 people who need treatment cannot receive it in Indiana. So here's the cost in money that IU in their report talks about. In 2017, it's at $4.3 billion in damages. So this is the total cost over a decade. Over $43 billion is what they were talking about as of December 31st, 2017. Here's our heat map. So this is what 2014 Narcan use looked like. This is as of September 2019. Can you see the difference? And it was passed in April 2015. So we are exploding with Narcan use, trying to prevent opioid overdose. So, you know, you look at this, and you know, one of the issues is we're using so much Narcan is we passed 2 bills, one in 2013, one in 2017, limiting the opioid use. It's this bill right here. And it was good intentioned. Let's limit opioids, then they won't be out there. So, you know, pharmacists can partially fill prescriptions. So, and, you know, patients don't get the medications that the doctors intended for them to have. They have a 7-day limit rule. So then patients have to go back and see the doctor. These things interfere with patient-doctor care. You know, when the government starts interfering with patient-doctor care, it starts causing people to have pain. It starts people start looking for other ways to treat their pain. They go to the street, the black market. They get heroin. They get prescription pills they think off the street are acceptable, and that's when they run into fentanyl and fentanyl overdoses. So in 2018, we passed the hemp CBD bill, which, and this was the process that it went through. And it was a battle. But this, I believe, helped some of the tide for opioid overdoses. I've talked to a lot of people that this has helped relieve some of their pain. And in the House, we had a 100% yes vote and no nays. In the Senate side in Indiana, we had 36 yeses and 11 noes. So it was well supported. Here's the effects of medical cannabis on opioid mortality. It decreased in medical states, around 7% decrease in medical cannabis states, so it's 33 states. In rec states, it was almost 15%. So you're looking at this, it's decreasing opioid overdose rates. It's incredible. So the more liberal the laws are, the lower the rates of opioid deaths. And I believe this is because cannabis does treat pain, and it does treat the withdrawal symptoms of opioids. So here's a study from Dr. Solka, where he had 542 patients, and 39% of people who were on opioids stopped using their opioids altogether. Another 39% reduced their dosages. Here's the important numbers. So 87% improved their quality of life, 80% improved their function, 47% reduced their pain by greater than 40%. This was a study in 2016. I presented this information to Jim McClelland in early 2017 when I was in a meeting with him and Jeff Staker, the founder of Hoosier Vets for Medical Cannabis. I asked him for a pilot study for Indiana to do a research just to see if we could verify some of this information. They refused to do this. And that is my report. Jason's still out, and my dog's going crazy. Gotta love them. See, here's my boys. Bentley, say hi to everybody. Teddy.